I am Josh, so a little bit about me. I'm fresh out of my undergrad, which I did at Dal. So I have a BA in political science and law, justice, and society. So not from a health background, but Dr. Packer is quite right in being that it's a very welcoming community, and I don't at all feel out of place trying to fit in among people who do have health backgrounds. So I'm currently in the first year of the MHA program, and I am doing it jointly with the JD, which is a really, really interesting ability that you have if you choose Dalhousie as a MHA school. So I've always had an interest in healthcare and healthcare leadership and healthcare law. So the MHA was a natural kind of landing point for me as a student coming out of my undergrad. And the ability then to combine that with the JD was incredibly unique. And I really enjoyed the unique freedom that that was going to give me and the diverse set of opportunities it opens up after you graduate. And then looking at my first month of school, which seems to have flown by at a rapid rate, I'd say an early highlight for me has been the collaborative nature of the program. Every day we're all in the same classes all together, and they ask us to discuss some really complex topics and questions that don't have easy answers, but with a really supportive learning environment and a cohort that's with you every step of the way, it's really, really supportive and a really fun learning environment. I think back to our healthcare law classes with Professor Hadskis, and we're having fairly in-depth debates about healthcare law and some really, really complex issues that are coming up in healthcare law. And it's a lot of fun. It's an interesting sort of experience. He describes us as very keen, which I'd say is probably about right. I've also been really impressed with the diversity of backgrounds that we have in the program. We've got everyone who's fresh out of school, and then we've got people who are doctors and nurses and midwives and pharmacists and dentists and physios. So the ability to kind of bounce ideas off of one another and talk to people who have some frontline experience is a really, really unique thing to do, especially when you don't come from that sort of background. So I found that to be a really excellent part of the program. And I guess the last thing that I'm going to touch on is the unique set of competencies that come with the MHA program. So at the beginning of the year, we have a self-assessment that we have to do where you have to rank yourself on 26 different broad categories ranging from like initiative and communication skills to project management and HR skills. So you have to provide a statement about all of those. And it's a really interesting way to look at yourself and where you are in your career and in your education. And then you get to measure yourself as you go along about how you're doing. And if you're ever confused, you have a dedicated faculty advisor who's there to walk through all of that with you, which is another really nice part about this program. There's always people there to help you and kind of guide you and make sure that you're on the right track. And with that, I will hand it over to Bria, who's going to walk you through some of the other aspects of first year.